Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now.
See you over there on Instagram.
I'm just having fun, okay? I'm just having a good time.
I'm glad. We just did we did an Instagram live, and it made me think of something. Well, the guy said his wife meditates all the time, and he was like, it was something like, is meditation different than mindfulness, and is it bullshit, or are there actual medical benefits? That's what the guy said. I think it's a fair question. But what comes to mind for me is, though, there's a medical benefit, then there's also like, what if something makes this person feel better or helps this person? Like, I like to wake up in the morning and I like to like write sometimes. Like, I don't do as much as I used to, but when I write in a journal, I don't know if you could say, yes, your blood pressure went down, but I'm telling you, it makes my day better. But say, I mean, if you did or didn't, the fact that for me, I feel better is enough for me to...
You could be my guinea pig. We could make this an objective study. I have blood pressure cuff in my closet.
Oh.
How fun would that be? We could actually do that the next time we're together for like a week straight. Who knows when that will be? But I could totally check your blood pressure before and after.
Okay.
And your heart rate. And your respiratory rate. We could check all your vitals. Even your temperature can drop. If you're extremely stressed, you can have elevated temperature. Minus or plus like a degree or so. It's nothing crazy.
Can I be honest with you?
I digress. I just went into detail there, and that's boring. That's what doctors do.
It's not
that
boring.
annoys us, right?
Before you continue, it's not boring. But lately,
Had a lot of caffeine.
you've been stressing me out a tiny bit. Let me give you an example. I call you up and I go, but you're doing it out of love, though.
Hi, Jamie.
Well, can I tell you why?
What a fun podcast we've started today.
Let me tell you why it's a little stressful.
Why?
Because the other day, I got two things, and then that's the third thing. The other day, I go, I'm having these headaches. I've been having like a vertigo. I've been having what I feel like are... You feel like you're getting old diseases, like, I have sciatica, I have what. But lately I've gotten so car sick. To be quite honest, it sucks because I fly into do Gutfeld. I fly all the way across the country, sometimes from Fairbanks, Alaska, sometimes from Boise. I'm not trying to complain, but the hardest part is the car ride from the airport because you're in the back of a car, sometimes for 90 minutes, at least an hour. And lately, it happened one day. I was talking to you on the phone and I said, I have to hang up because I'm so motion sick. I can't even talk to you. Like, I felt so bad that I couldn't even talk. I can't look at my phone. I can't listen to anything. I have to just like look at the road and like let the information from my eyes come, or I will like feel like I'm going to throw up. It's been happening to me. It's been like months now, right? And then I also get these headaches sometimes, which is kind of weird. I was going to do a joke there, but I decided not to. I was going to say, but it sucks. I felt like I was being too serious for too long. But, and then you help me with a way to take care of that. You prescribe me something, and then you're like, hey, you know what we're going to do when you visit Boise Tuesday? And I go, what? And you go, we'll get a quick brain MRI. And I was like, fuck. Sometimes I feel like I get worried about.
Well, that's fair.
Because like the blood pressure thing. Remember I was at your office the other day, and you go, hey, come into the office, and you guys stab me in the arm with some sort of glucose monitor. Was it a needle?
It was a Dexcom 7. It basically,
How do you
it's a tiny, with firm pressure to the posterior aspect of your upper forearm.
If I were in New York City and I go, I just got stabbed, would you go, how thick was the knife? I want to really,
If you're in a medical facility and someone puts on a continuous blood glucose monitor,
that's what
I don't think you can compare that to getting knifed in the streets of New York City.
Now, you didn't give this to me for any reason except for you had some and you thought it'd be fun to track such a thing, right?
Yes.
I wasn't like I had a condition. Did you not, you would then put one on the next day, did you not feel a stress? I felt that it stressed me out.
I actually felt it to be disappointing.
Really?
Yeah. I'm a very curious mind. Most physicians are. So I'm very intrigued by the body. I was excited to test it and see how low I would go and then see how much I could make it spike with certain things that I ingested. And
to tell people that don't know what it is, it gives you a reading every 5 minutes. So, I mean, this is like up to the minute you eat a thing, you can see if it does something or not.
Yes, it continuously stays on your arm for 10 days. So it all night long, records it so the next morning you can see.
Yeah.
The only thing that I found very frustrating, and you as well, were the alarms alarms when it would go too low.
Oh, yeah.
I'm asymptomatic. I'm sleeping. I'm not a type 1 or type 2 diabetic.
That's weird.
I have no history of hyper or hypoglycemia, low or high blood sugar, right? So for me, I try to set the alarms really low.
But for somebody would that save their life for somebody, but not for us?
I don't know that it would be a life-saving measure depending on the number. But if it went way too low, yes.
It's annoying AF, I'll tell you that.
It is, because it was set to go off at like a 60, which you and I intermittently fast sometimes for a while. I mean, gosh, we fasted for what, up to a week at a time? So like when you have this on and it's saying you're low.
You don't mean fast for a week. You mean fast for
I fasted
each day for a week. Oh, you mean I've never done that shit? You mean you didn't eat for a week?
Yeah, I told you that.
Oh, I've never done that. You said we. I have never. I will do the window during the day, but you have done the bigger fasts.
3 times maybe? I've done like a week long of like drinking like 200 calories of glucose essentially.
Yeah. What
but
about
otherwise nothing.
Remember the I feel like as a couple we have a good, I don't think we have a lot of secrets. We have a good phone policy. You know, like some people are real protective with their phone.
Yeah.
I was out in the kitchen and you were doing something, showering or something, and you left your phone out. You might have even gone to sleep, actually. I can't remember.
You said shouting.
Showering.
Okay.
And your glucose thing kept going off, and it was so loud. And so you've told me your phone passcode like for sure 20 times. I don't remember it. And so I tried opening your phone. I tried making a very judgmental face like you do when I tell a joke. I was like, that didn't open it. And then I tried to remember the code because it kept going off and it was so loud. Kept waking your dog up and your dog would go nuts. And so I kept trying different combinations of like significant days in your life. And then it was like, you can't open this phone for 1 minute.
And then 5 minutes, and then you locked me out, and then I finally woke up. But didn't you shove it in the couch or something?
Yeah, I stuck it in the couch. But can you imagine if we had a relationship though, where you're like, why were you breaking into my phone? And I just tried to turn it off.
Yeah. Remember when I was going to therapy, my counselor, and you wanted to go to a coffee shop, and this is when you like first kind of started living in Boise, and I was like, oh, just take my phone because you didn't know where to go. And you were like, what? And I'm like, what? Just take my phone.
I'm just used to a bad relationship where phones is protective phones. I remember once, red flag, you're probably not going to want to hear
with
this.
Me?
No.
Oh.
I remember once, my ex-wife, similar situation, I had forgotten my phone, and I go, hey, could I just like borrow your phone for a few minutes? And she goes, no, take this one. And she put, it was a secret.
You're joking, right?
Burner. Yeah.
You're just trying to be funny? Mm-hmm. I went through an ex's phone
She goes,
once.
oh, that's my burner phone. Did you? What could you get? Nothing. What are you going to do?
Oh, talked mad shit about me and my mom.
Come on. Mm-hmm. Damn. Had you already broken up with this person, or was it
No.
Oh, shit.
Talked about going to strip clubs, very vulgar things about women.
If you took my phone.
Making fun of me. And it wasn't talking shit like,
what?
Oh, Erica and her mom said this. It was like, oh, I have to like go hang out with the old ball and chain and her mom again.
Come on.
And we hadn't done it, and we had a great relationship.
What a
it was like it was like a facade of like, I'm this cool guy who doesn't need anybody. And then he was like super nice to me and my mom and respectful. But then
it's even worse.
Yeah. So
if you went through
and I found someone that was hitting on him and flirting with him a lot, and he respectfully declined. But yeah, I went through it because...
Who was the person?
I can't remember. Who?
Were they like coworker? Attractive or not attractive?
Oh, unattractive coworker.
Doesn't count. Not worth much. Not a lot of points scored.
Well, the point is I didn't normally do it, but it was kind of a similar situation. Something was continuously going off, and he had said, hey, when that happens, grab me. And so I grabbed the phone, and it was this woman. It wasn't the message that he wanted.
If you went through my phone, you would be...
So I saw that and I was livid, and I was like, you gave me permission to look at your phone, and when this person texted you, grab you, because he didn't want to be disturbed on something else he was doing. And I was like, that's fine, whatever. And so I'm in the kitchen. I don't even remember what it was. I never really look at phones.
If I found
but when
one
I saw
little
a
thing,
woman, a name of a woman who was like, oh, you looked really attractive at the company party, blah, blah, blah. And I was like, oh, hell no.
But what's wrong with... I feel like there's nothing wrong with that if she's doing it. If there's coworkers, it's the more the talking shit thing. Who cares if someone... Like, that's not his fault,
That's
right?
how I found the talking shit stuff.
Gotcha.
It was because I saw a woman flirting and saying, hey, do you want to go out? It was like, you looked really cute. We should do it again. And I was like, what?
Damn.
So I looked and I went back, and then I saw that other stuff, and I was like, this sucks.
I'd read everything.
I think that if you don't trust the person in the beginning, then the relationship sucks. That's why I've never gone through your phone. I have no reason to.
I feel like if I went through my phone, you'd be like, this guy's fucking nuts.
You would see so many pictures of inappropriate things. Good God.
On your phone?
Oh, yeah.
What
There's so many pictures of like uncircumcised penises on my phone.
For what?
Well, I had a patient who was like, I don't know if my partner's circumcised or not. So I pulled it up.
And they sent you pictures of this person's penis?
No. She was asking questions about sanitary stuff, why she was having recurrent infections. We talked about the predisposition to an uncircumcised penis usually having more bacteria and causing more infections. So I was telling her how to clean it. And then she's like, wait, I don't even know, like, to tell her partner to clean it. It's not her job. Clean your own.
Really?
dick.
So someone texted you?
No. I pulled up pictures on my phone from the internet because she finally said,
That's why mine has those too. Vagina. Some friend asked me about a patient, and so if you looked at my phone and you
that
saw
was fast.
saw
That
shave,
was fast. That's why.
Yeah, if you saw.
Yeah. I have butthole pictures. I have boob pictures. I have nasty discharge stuff. Like, I've got inappropriate stuff. That's just the nature of it.
Okay.
So have fun.
Listen, if that's not true, you just did a great job.
Here you go.
By putting. I already forgot your password, but that's a great job providing context if you want to go to a website. No, but I
do get pictures though. I was at dinner once and somebody texted me, "Hey, my significant other is coughing up this stuff. What do we do?" And it was just a picture of all this green stuff.
I don't think so.
Like in a bowl, and I was like, "I'm at dinner right now. Like, what are you doing?" So.
Okay. Do you remember? I'm going to be honest with you. I don't remember why I brought this up. I think we were talking about, why did I bring this up? The phone thing. Oh, the glucose monitor. I said you stress me out sometimes. I don't mean that in a bad way at all. I just mean sometimes the constant monitoring of your body does make me feel like, am I going to find something? That's what we're all worried about. Some people think, incorrectly obviously, they think they get sick when the doctor finds it. They go like, man, if I hadn't gone to the doctor, I'd be fine. They're the one that told me that this thing, which is obviously silly, but that's true. That's where you find out. That's where you get the MRI in the brain.
There is reason to that too, though, because medical procedures can go wrong, right? So we don't like to operate unless we have to. So there are risks and side effects and complications, infection, bleeding, damaging the wrong organ. I mean, there's a lot of things that can happen. If you have an incidental finding and you go after it. So patients
That's what I'm saying. And to slow that down, I think, yes, incidental finding based on...
we shouldn't like jump to the knife.
No.
But if you're symptomatic and having vertigo...
I do have vertigo.
You're symptomatic and having chronic, recurrent, worsening progression headache.
I don't know if it's worsening, but I do have them.
In frequency. Mm-hmm. They're becoming more frequent.
What could be the worst thing that could happen to me? What could be the worst?
Well, we'd be looking for a brain tumor would be the worst possible thing.
Oh.
But the thing is, you don't have any focal neurological deficits. You're not having visual field defects. You're not having problems with your gait. You're not having weakness, lightheadedness. You're not having slurred speech. Your mentation is typically intact unless you're trying to sound really smart, and then you never have been. But,
wow.
See, you're fast. That was a dumb joke. I shouldn't have said that. You're very
smart.
You
just discovered that Joe Biden has a brain tumor.
No.
You just listed everything that he's done in the last 24 hours. Slurred speech. Trouble getting down tiny stairs. Did you see?
I feel bad that I made a joke about you not being smart. You were very smart. I take that back.
That's okay.
But my point is, I've honestly, again, I've told you this before. I don't feel comfortable speaking on him because he's not my patient. You are my patient. Right. So legally, you've consented for me to say stuff on here.
So anyway, but thank you. But
I can prescribe you stuff.
I don't know about, we should check blood pressure, but maybe we won't.
Okay, well, here's the thing. I think MRIs are amazing. This stuff that's come out, I used to say it all the time. You know in the movie Black Panther where they have that machine that scans them and it can heal them?
Yes, don't they sneak into someone's house, the poor people, in order to get fixed by the machine? No? Doesn't she bring her kid? Doesn't she? I think it's a different movie? Different movie.
I don't remember.
I'm thinking of a different movie.
Right. I think you're right. I don't know. But it scans the whole body. Mm-hmm. Well, we don't have something that will like fix a body by scan, but we do have full body MRIs now that are available. Mm-hmm. The tricky thing is it'll find a lot of stuff that you're not looking for.
Exactly.
And then what do I do? But for you have symptoms. We should rule out any type of neurovascular compromise.
Okay.
So blood vessel problems, nerve problems, masses, swelling. We're going to look at your ventricles. We're going to look at the whole kit and caboodle. And there's no radiation exposure.
So when do I know? I'm in the thing. How long is my head in there? The lady asked me some weird questions. She goes,
metal clips.
What?
You can't have metal in your body because the MRI.
She asked me that. She asked me if I could stand up on my own for 10 minutes.
You'll be lying flat for it. They'll put you on a board and then you get moved under and the machine goes right over your head. They'll play music. You can usually choose the music of your choice. If you'd like, I can prescribe a sedative beforehand. But typically,
let's get a sedative.
But typically, because you and I are now getting married, I can't. I won't. I could, but I won't risk my license.
What about what? By doing what?
I'm comfortable because I've seen you in office and I have a chart note.
Oh, I don't really need one. I'm just kidding.
And I have chart notes to say I've seen you as your doctor. I can prescribe things like an antibiotic or something else necessary. But if I was going to give you something to calm you down, I would have another doctor do it who has also evaluated you, because we can lose our licenses that way. So I'm very protective over that.
We'll see how it goes.
But you can have one and it can calm you down, and then they scan you and then you leave.
How soon after do
Within
I find
24 hours, we'll probably have.
Hours.
It depends how busy the radiologists reading them are.
Would they? Is it like a range? Do they either go, we didn't find anything, or would there ever be a world where they go, dude, you fucking crushed this thing, good job?
If they wrote that in a report, I would highly question
would it be like, dude, you are
intelligence level of that radiologist reading the report.
You're fucking quick, dude. We saw it on the machine.
No.
Shit.
But they'll go through everything. So they'll go from like top down, right?
Top down.
So they'll talk about your brain. They'll talk about your eyes. They'll talk about your sinuses. They'll talk about like.
You're making me nervous now, like very nervous.
Why?
I don't know. I feel like there's something wrong with my eyes. I feel like I can't see very good.
No. It'll be like behind your eyes. Like it's not evaluating your eyes themselves. Sorry.
Okay. All right. We'll see how it goes.
You use something really cool called an optic chiasm that goes like this. And like if you get messed up on this side of your body, it actually runs the nerve to this side. So this eye loses vision. There's so many cool things in the brain. It's insane. The brain is my favorite organ by far because we don't understand it all the way.
We do not understand it.
Like, can you imagine a brain transplant?
No. I don't. Can you imagine being a brain surgeon?
Yeah.
That's your job, is just going there and like boopity beep. Right?
I mean, you know what was cool? It was cool to see like craniectomy where like they saw off the whole top of the skull and do stuff. I don't know. I think all doctors are equivalent. I hold them all in regard with...
I'm just saying.
Are you going to insult me now?
No. I'm just saying you're at a bar. Guy goes, oh, I'm a neurologist. As opposed to, that's the one I always use, but like, oh, I'm a foot doctor. You're like, oh, okay.
But the neurologist doesn't know how to treat a foot.
Doesn't give a fuck.
It does if you have foot problems.
He could squeeze a little part that makes your foot quiver. He's in control of the whole thing. Can live without your foot, can't live without your brain. Right? They don't say when you're doing something difficult, they go, oh, this isn't that hard. Come on, it's not foot surgery. That would be not that hard. They go, this is put up, you can build that shed. It's basically like foot surgery. Oh. I got it.
Tell that to an Olympic athlete who wants to run.
I will. I don't have anyone's number. But we just had a couples massage. And did you enjoy yours?
Where'd that come from?
It's related.
Did I enjoy mine? No.
You didn't?
I told you that. I didn't relax. I told her I was having low back pain. My quadratus lumborum is really tight, and I was having some referred sciatica pain. So to work on that area. So she dug into it. So it wasn't relaxing. It was quite unpleasantly painful.
I'm sorry. She said to me, she goes, is there any part of your body that I'm not allowed to touch? And I go, anything outside of my dick and balls is really sensitive.
I told them everything was fine. When you were in the bathroom, I told them everything was, I said, there's no body part off limits.
Oh, I told them anything but the dick and balls were off limits.
Stop it.
You did tell them. Well, I'm sorry you could. It's funny. We had a question come in. You always ask me who asked the question, and I forgot. We had a question come in because I felt bad for you because you said I was in my head the whole time. And I fought myself today because we both have a lot on our mind. You arguably more than me. But I think I kind of did a good job. I was using mindfulness. And I was not necessarily meditation, but I was going, I was like really appreciating what was happening. And I felt my brain trying to pull me back in.
Okay.
But I would fight it. And that's the whole process. It's okay. You're not failing. So this one guy was asking on Instagram, he was like, this is not really a medical question, so I don't expect you to. But he was saying,
well, I bet the brain surgeon could answer it.
But he goes, meditation, the foot doctor.
But not the family medicine doctor.
The foot doctor would be like, what is meditation? No, of course. But no, I'm just saying this isn't a medical question. He just said, is meditation different than mindfulness? My wife does it for 60 to 90 minutes a day, and she swears by it. This is how we began this podcast, isn't it? Didn't I say? Or maybe that was off the air. But anyway, he said, are there really benefits, or is this like a waste of time? He's like, I got to get the kids ready by myself. It's like an hour she's in the room doing this meditation.
Well, that's different.
This is how it all started, because I said the journaling. Remember? I said, like, I wonder if journaling helps, but what if it helps just for me and it's not quantifiable?
I had a book called Mindfulness in Plain English and Mindful Meditation. So you're getting into
You
semantics.
read a book called Mindful?
Part of it.
Oh.
I like to collect books and not
You
read them
have
all.
read more beginnings of books than anyone ever read.
I'm amazing at reading the first chapter.
You're real good at that.
Well, I wish they would let you read the entire first chapter and then decide if you liked it or not.
So you're saying you read it and don't like it. It's not that you're going, I'm no longer interested. Meditation and mindfulness are very similar, but I would say that the difference is that mindfulness is a way of life.
Correct.
And meditation is like taking a half hour.
Active practice. Well, here's the thing. I think there's arguments on both sides. If you are doing it to avoid responsibilities and making your partner suffer because you want to put yourself first, that's not okay. If you're doing it on your off time and then you're more relaxed, you're more pleasant, you're more approachable, you're also more amenable to their needs because you've already taken care of yours, then you can be a better partner. So it depends on when you're doing it and why you're doing it.
Shit, we need more information. You're absolutely right. That's a very, very tough subject. Yeah, you're right. We need a case study here. Because you're right. It could be she's leaving. She's just like laying in there going like, let him take care of everything. And she's not really doing anything. But there's supposedly lots of benefits to
I have
breathing.
huge support for meditation, mindfulness, any type of relaxation to help people for a lot of reasons. Obviously for things like generalized anxiety disorder,
Stress.
PTSD, regular stress, day-to-day job. Panic attack disorder is severely impacted by things that can trigger you suddenly. And if you have trained your brain to instantly go back into, so we've done guided meditations and things like visualization, right? That one is awesome because people will go to like a calm valley or something and relax. Well, you can do that in a workplace. You can do that if you are at a grocery store and suddenly something stresses you out. You can pause, immediately bring yourself back to that place where you have relaxed and trick your brain into a subtle relaxation. But we have absolutely proven that your statistics on your vital signs improve with lowered blood pressure, lower heart rate, lowered respiratory rate. People can have tremors that slow. You can have a really good health benefit if you do that long term too.
You recommended one to me that was this guided meditation. I do it all the time. I wish I could remember. It's called Goodbye Worries or something.
Yeah, it's by Roberta Shapiro.
Roberta Shapiro's on Spotify. It's free.
It is free. She's a licensed clinical hypnotherapist.
Yeah.
And she does a lot of things with anxiety and worry and stress, but also for sleep.
I have one criticism.
What?
My favorite meditation of hers, she gets you into this. She does this great way of sort of inducing you and relaxing you where you look up at your eyelids and pretend there's like weights on them. It's amazing. And then she says you have this backpack filled with worries. And then I'm usually in deep by then. And then it goes go up to this river.
Dump them in.
You dump them in. And every time I do it, I'm like, they should put a garbage can here.
Because you're being
polluting
wasteful.
this river. They should put just one bin. It's just visualization. It doesn't cost anything.
What I like to tell people is to do it every single night for 3 weeks because it takes about that long to develop a true habit, right? After that, if you wake up in the middle of the night, you start to listen to it again, your brain immediately recognizes it and falls into a quicker state of hypnosis and relaxation. So you don't have to listen to the half an hour or hour long meditation, whatever one you choose. It's very good to help with insomnia.
Makes sense.
And guess what happens when you sleep better?
When you sleep better, everything's better.
Your day is better.
Your stress level's better.
Your tolerance for bullshit is improved.
Or spouses.
Work is better. Your outlook becomes more positive. It reduces anger in the workplace. I mean, we have so much proven, documented studies to show that if you have a better mindset, you have a better outcome in life from your day-to-day things.
I think you're right about
practice. You can't just do it once.
You're right. The 3 week thing is very important. I tell people that whenever they go, I'm trying to start smoking. I go, listen, 3 weeks, you're going to want to do it every day because at first your body's going to reject it. I go, you smoke for 3 weeks. I'm telling you, you're going to wake up the next day. It's going to be like a secondhand like habit, you know?
Why would you say that?
Would you have been offended if during...
I'm already offended.
What if we're in the couples massage today and I was trying to be mindful You were thinking about a lot of things you had to do because you have a lot going on. Not faulting you. Would you have been offended if you looked over
and saw your penis
and I had a huge erection
while getting the massage?
Yes. Like, really?
Of course I would have been.
Okay. Didn't. Just throwing it out there. There was one time when No, I didn't have one. But there was a moment where I go, God, it's like, this is weird, right? Like your face up, your tip up. And when she does like the inside of your thigh part, I go, what would happen? And I start thinking.
When you do the inside of your thigh, for a man, you have a cremasteric muscle reflex where your balls go up higher. It actually pulls them up.
Would you be offended if my balls had been heightened?
No, because that's a true anatomical response.
Okay.
It's fun. When we learned it in med school, you'd see all the guys like sitting in class, spreading out their thighs and like stroking it to see their balls suck up. And
what
it does happen.
What are you talking about?
It's called the cremasteric.
I know, but why were they doing that? In front of everyone?
I told you. Well, yeah, doctor. We also learned that one testicle always,
hangs lower than the other one?
Hang lower than the other one. And you'd see all the guys in the class going, like looking down
it's
and going.
It's the same one for most guys, by the way. It's like right or left. I can't remember.
Because it gets hung up on other anatomical structures on one side because our bodies are not exactly mirror images right to left. But that's what I meant about doctors are like fascinated by stuff. So I'm constantly exploring and curious, and that's why it's kind of fun.
You would have been offended though? You wouldn't have been like,
if you had curious. A hard-on
just
from another lady touching you?
But
non-sexually?
So if it was a guy not angry,
I would have laughed hysterically because I would have known you were probably mortified.
It's funny that
if Jason Momoa was your massage therapist and you had a hard-on, I would have fully encouraged it.
I don't know who that is.
Yes, you do.
Is he Aquaman?
Yeah.
Fuck.
Huge guy. That's what I'm saying. Like, it'd be funny if it was a huge guy giving you a rub down and you were like, you rolled over and you had a boner. Because I know you would have been mortified.
But then why would it be different if it's
because it's not sexual for you if a guy does it because you're heterosexual. If a woman does it and you have a hard on, it makes me think, are you thinking about me?
Right.
Are you thinking about her? Did she get too close? Is she into you? This is our couple's massage. Pause off, lady.
Yeah.
And then yours? I must be mad at you.
I thought this lady was very professional.
I didn't get turned on when I was getting...
I did not get turned on. I thought it was a little...
You just said you had a moment.
I thought it was a little bit unprofessional when she got under the covers with me. And I did not know that was part of it.
Did you did take your underwear off, right? At the last minute? You did. I think I saw your penis.
I did. I didn't want to.
You were very hesitant.
Because we're
in
there.
You told me if it was not me,
do you know why I was hesitant?
Keep your underwear on.
Do you know why I was hesitant?
Because of a hard on?
Yeah, and then I thought it would start an argument.
That's honestly why you were thinking that?
Yeah, what if the blanket brushed together? Any guy will tell you.
This whole time I thought you were being modest and you were scared because I usually keep a thong on when I'm getting a massage. You wanted to keep your underwear on strictly to keep your boner in check?
Do you know when I got that massage? We went to a couples massage. That's what you're planning on?
Did you get a hard on when the guy massaged you when we were in the couples massage in New York?
There's a guy and a girl, and you go, I'd really feel more comfortable with a girl. And I was like, oh, cool. It's ruined. And so I had this guy massaging me. I can't have men
massage me. I did it once. I could not do it. It felt sexual.
Yeah, it was. It was. Look at you.
No, I just meant like I'm very uncomfortable having any man touch me unless it's my partner. Even if it's like him rubbing my knee, it's just, I can't do it.
I hear you. This woman was very professional. I did not get an erection. I just wanted to ask you that because there was one moment where you're face up, and I remember thinking, wouldn't it be funny if I got an erection and Erica saw me? And then I started thinking about you, and I started thinking about some stuff.
I would have called you out in front of both of those therapists today. I would have been like, "Why is your penis big?"
They should charge you an extra $30 if you get an erection.
To make it go down.
They've seen it.
That's creepy and gross. I was thinking during the massage how lucky they were that we are both showered. I had just shaved my legs.
Yep.
You have nice muscles. And so she's rubbing like your body and thinking, oh, these people are like groomed and clean and smell nice.
We did keep them. Yeah. I'll bet some people don't give a shit.
And I think that's very inconsiderate.
Yeah. Yeah. I would love to talk to
I almost
a
think
massage therapist
instead of them
questions.
saying, are you going to tip us? They should have been like, we will tip you because you came in ready to go.
We were, I would love to talk to one and find out.
And we were a very polite couple.
We're very polite.
Immediately I told them what our needs were, that they didn't have to stay away from certain areas of the body. And then like we immediately changed and got ready. And then when they said, you're done, we got up and left. We didn't do any funny business.
No.
There was no boner at the massage parlor.
Nope. I had a sad ending, essentially.
Sad ending? Next to me?
No, instead of I just meant like a happy ending. You can't win in this situation.
Mouth
so
shut.
Listen, we have to go.
No, we can't go. I have stuff I want to ask you. I pulled it up on my phone on Instagram. It's hilarious.
So listen, for next time,
rapid fire questions.
So we're going to talk about.
No.
We're going to do for next time. Wait.
No.
I would like to know. Do men's balls really get bigger and lower as they get older? Don't answer. And then what tease your thing? Just do a tease.
Well, it was like 15 questions to ask your partner to really embarrass them. And if they pass, then they trust you. If they can't answer them, then they're hiding something.
I love it. We'll do it next time.
No, I'm ready to go. I'm locked and loaded.
Do you know we're producing a podcast?
I got a hard on under the sheets. You're just leaving me.
Do you know that we're going to talk about it right now?
Let's talk about a sad ending.
I'm just pretending the episode's ending.
You're bothering me.
Do you know what I'm saying? We're pretending it's over. And then
you're going to have 2 sad endings today.
Coming up on the next episode of Afraid to Ask.
But not in a public facility.
So this is in a public facility.
That's not appropriate.
Not joking at all. I've seen this more than once. Always an old guy. And as guys get, whenever you look over, like this one guy, his balls, it looked like if I had been at a baseball game and it started raining, they could have covered the field with it.
That's so gross.
I'm serious.
That you said that.
It looked like...
I don't even want to... Now I'm thinking of like hairy ballsack wrinkly tarps that are like pink bubblegum colored. Why would you do that?
When he was leaving the locker room, his friend
was... Big League Chew.
Yeah, exactly. When he was... This is true. When he was leaving the locker room, his buddy was holding it behind him like a wedding dress.
Stop it.
He was holding it up like a wedding dress.
I don't want to go there.
Is it?
You also asked me once... man boobs if they happen as you get older.
Yes, because double question, because a guy on Instagram said, what are those D cups he said to you about your breast, which I felt like I got offended.
Are you offended?
You did really?
Yeah, because
I feel like that's offensive. I feel that women have it just right out there.